Julia Smith, RN, BSN, and I'm going to talk about hand washing today. Um, we're going to be discussing asepsis infection control in the area of hand washing. Hand washing is the first line of defense in the preventing of infection spread in the healthcare setting. Washing your hands using the proper techniques helps to decrease the spread of infections acquired in the healthcare setting, or what they call this infection is called a nosocomial infection. There are two types of techniques used to prevent infections from spreading in the healthcare setting. One of those is medical asepsis, and the other is a surgical asepsis. We're going to discuss hand washing today, which includes medical asepsis. Washing your hands breaks a link in what's called a chain of infection. The chain of infection includes the following links: transmission, portal of entry, host susceptibility, infectious agent and reservoir, and portal of exit. Washing your hands prevents transmission of disease so that it does not spread. So when we're discussing washing your hands, some of the things you want to think about that you would wash your hands is before you touch a patient, before clean aseptic procedure. For example, with CNAs, that would include emptying a Foley catheter bag. After body fluid exposure, that would be with changing incontinence briefs, fluids such as urine, and after touching a patient, after touching surfaces that are in the patient's rooms. So kind of summing it up, anytime you work with a patient, you want to wash your hands. And you also want to use gloves. But we're going to discuss the portion of hand washing prior to putting your gloves on that the facility provides. So let's come on over to the sink and we're going to wash hands now. So we're going to start with wetting our hands with water. So I'm going to turn on the sink, make sure that it's nice tempered, not too hot. And then I'm going to kind of wet my hands, and then I'm going to apply just enough soap to cover my hand surfaces. And soaps can, differ depending on which facility that you're at. So what I'm going to do is I'm going to rub my palms together, and I'm going to make sure that I'm getting between my fingers and on the backs. And a good method too to use is using your knuckles like this, and then getting under your fingernails and your palm of your hand and switching over. You want to make sure that you're getting under rings, so scrubbing under there. And you want to make sure also if you're wearing a watch, you're getting underneath that watch. And you want to get the wrists covered very well. And a good method, because you want to make sure enough time has gone by, is to do the ABCs. So I would just do the ABCs and continue on. And then after I would go to rinse my hands, I make sure that I get my wrists and they're all soaked off. I don't want to touch the insides of the sink at all. And then I'm going to grab some paper towel. And I'm going to dry thoroughly off all those surfaces that I just covered. I'm going to discard it in the wastebasket, and then I'm going to grab another piece here, and I'm going to use this to turn off the faucet. So, toss that in the garbage. So basically overall, covering all those surfaces and making sure that I'm stopping that chain and that link of spreading infection, so that I'm not transmitting infection from one patient to the next. Now it's a good time to stop the video and then partner up with a partner and have them go through a checkoff list with each other, and then it's a good time to kind of screen each other and give each other some verbal prompts where you might need to improve, so that you can kind of perfect your hand washing technique. So at this time we're going to stop, and I'll come back later. Thank you.